So, like many people here in Toronto, I am self-isolating. My practice has gone entirely on the telephone, FaceTime, or Skype, and I'm observing in myself and in my patients and in everyone around me um, a fairly widespread regression. That psychoanalytic term referring to a falling back, a moving back from more mature to less mature stages of psychological and emotional functioning. In Kleinian language, this is a regression back from depressive position functioning to paranoid schizoid functioning. Um, So to the extent that this crisis is promoting paranoid schizoid functioning, persecutory anxiety is widespread. People are feeling persecuted, and this persecutory anxiety is activating defensive measures. The kinds of defenses that one usually resorts to. So, oddly enough, I find my somewhat paranoid patients are feeling a bit better because now everyone's paranoid. My hysterical patients are feeling better because everyone around them is now rather hysterical. That is, having somatic preoccupation, self-observing for symptoms, generating symptoms on a hysterical basis, being hyper acutely aware of their bodies, any signs that they might be beginning to show, the fever, the chills, the dry cough, etc. So hysterical patients are feeling better. Everyone's a bit hysterical. Obsessive compulsive patients are feeling better because now everyone is obsessive and compulsive. Everyone has a socially recommended hand washing compulsion all of a sudden. So symptoms that used to seem pathological are now seeming entirely justified in the face of a real crisis. But as usual, the problem with paranoia is this two-sided issue. Some people are clearly overly paranoid, and other people are underly paranoid. I myself tend to err in the direction of the under-paranoid. Some people around me are much more alert and were much more alert to this serious crisis weeks before I was. Like a lot of men, I guess, I err a little in the macho direction. I'm strong, I'm independent, I'm not so vulnerable. And of course, that soon broke down, and I recognized the reality of the crisis and of the reality that I'm in the age group most vulnerable to serious consequences if one contracts this virus. So having been a bit under paranoid, I don't think I've swung to the opposite extreme and become overly paranoid. I'm trying to find that middle ground, which of course is impossible to find. I'm trying to use reason and rationality and to be informed without reacting either in an over or an underly paranoid direction. It's significant that this crisis comes now when, in fact, I think without realizing it, we've all been suffering, or many of us have been suffering, from a kind of unconscious guilt, because we've been becoming, over the last decade or so, more and more aware of anthropogenic climate disruption. And in this period that is now referred to as the Anthropocene, some are predicting the coming sixth extinction due to anthropogenic climate disruption. Certainly from a Kleinian point of view, the environment, the first environment is mother's body. And on an unconscious level, I think we all continue to associate nature with mother nature. And there has been a sustained assault on Mother Nature by both capitalist and socialist industrial and post-industrial societies, rape and extraction, fracking. We've been attacking Mother Nature. And for Klein, the baby is very anxious that his attacks on Mother Nature may destroy her, or if my attacks don't destroy her, they may set up a counterattack which would destroy me. And so now I come to be in a state of persecutory anxiety of nature. Nature will counterattack. Retribution for my attacks on her. And so here we are in the middle of what in fantasy could well feel like a counterattack. I mean, we were pretty good with the dealing with the hairy mammoths and other predatory creatures, attackers, but the current attackers are invisible, minute. We can't see them. So this qualifies the virus as what Wilfred Bion called bizarre objects. He's referring to the process whereby, to resort to the Hollywood films, when we cut off the dragon's head, it immediately grows 10 more heads. We attack the monster, and that only transforms it into a swarm of monsters. And so here we are feeling swarmed by a virus, potentially deadly for some of us. So here we have intense persecutory anxiety in the face of a predator that we can't see, that could be coming at us from many directions, and that it is very difficult to protect ourselves against. So we're all in hiding. We're in hiding from this predator. Anxiety level is high, and so now schizoid patients, like paranoid, hysterical, and obsessional patients, are feeling better. Schizoids always wanted to withdraw, and here we're being instructed to go into social isolation. So the schizoid defense is socially authorized and recommended. Um, so in the face of anxiety, we regress, and certainly to turn to the Freudian perspective, uh, I think we see both anal and oral regression. Um, why all of the hoarding of toilet paper? Um, I had a brief discussion of this issue uh, with a graduate student in psychology and neuroscience, and she had some interesting thoughts about this. Um, Certainly, in the face of the virus, we are experiencing a loss of control. And, control is a big issue during the anal phase. Toilet training, who's in control? Am I autonomous in my bowel and urinary functions? Is the caretaker in control? Who's the boss? Who's dominant? Who's submissive? Am I being controlled or am I in control? So control becomes a big issue around cleanliness, around holding on and letting go. Getting fixated in the anal phase can lead to expressions like hoarding. And so here we have the hoarding of toilet paper, which brings to mind the phrase, "I was so scared I almost shit my pants." And so here are people suffering from varying degrees of persecutory anxiety, running out and hoarding toilet paper. Would seem to be a pretty clear indication of anal regression. Other furious attempts to gain control, obsessive cleansing with materials that are, antibacterial agents of some kind. Oral regression, the hoarding of food, fears of starvation, fears of running out of the necessities, stockpiling. One of the characteristics of the paranoid schizoid position is that time seems to give way to a sense of the eternal. Whereas in the depressive position, time is a reality. It's flowing from the past through the present into the future. In the depressive position, the future exists. And because the future still exists, there can be hope. But with regression into the paranoid schizoid position, we're falling back into a state where it's as if time stops and we're frozen into what feels like an eternal condition. And I think this is a danger. As this crisis goes on, we're isolated in our homes. It can begin to feel like we are stuck here forever. Will this epidemic, this pandemic, ever be overcome? Will it ever cease? I think in this condition, it's important for us to try to recall the reality of time. Time passes, things will change, the epidemic will pass to one degree or another. If it returns, it will pass yet again. We have to sustain hope, which means sustaining a sense of time. We need to be thinking of the future. We need to be thinking about rebuilding, getting things back to, quotes, normal. Once again, hope has to be sustained. Okay.